Live from the Washington, D.C. area, it's the Inside Scoop. All the news that our viewers want to know. Now, here's the host.
Welcome to Inside Scoop Virginia. I'm Bettina Lawton and I'm your host. And tonight we're going to be talking about heroin. Is it a problem in Fairfax County? We have seen in recent months the U.S. Attorney General, Eric Holder, said that it was an urgent public health crisis. We have had the the Virginia Attorney General has announced a heroin and prescription drug abuse strategy. There was a summit in Winchester, Virginia a few weeks back to talk about the epidemic issues involving heroin in the Shenandoah Valley. The Fairfax County Board of Supervisors last month passed a resolution asking the staff to study the problem and report back to them. So, is it a problem? We're going to have two perspectives tonight. We are going to have the preventative type perspective from the United Prevention Coalition of Fairfax County and the Fairfax and Falls Church Community Services Board. And they're going to talk to us about treatments that are available and what's going on in that area in both the public and the private sector. And then we are going to be talking with Captain Paul Cleveland from the Fairfax County Police Department and Sheriff Stacey Kincaid from Fairfax, and with Vera, Giles, who is the Chief Medical Officer for the Fairfax County Jail. So we're going to start with Captain Paul Cleveland, as you can tell, because the logo is up behind us. So welcome to the show. I appreciate you taking time out. So first of all, let me get clear on what actually is heroin. I mean, I grew up in New York when everything was a felony. Marijuana was a felony, so you didn't do drugs. And so I don't really know what heroin is.
Well, it is an extremely addictive illegal drug. It is made from the resin of an opium poppy. In the state of Virginia, it's classified as a Schedule I narcotic. So it's a felony in the state of Virginia to possess and or distribute heroin. It is a very, very addictive drug that most people, once they're on it, have a very difficult time getting off of it. In most cases, people don't start with heroin. There's a lot of things that lead up to heroin. It is probably, in my experience in 21 years of law enforcement, it's probably the most devastating drug that's out there, because once people are in the throes of addiction with heroin, as I said, it is extremely difficult to get off. And it not only devastates them physically, but they go through an entire, the family impact, the financial impact. People lose everything once they're in the throes of addiction with heroin.
Well, why has heroin suddenly become so visible? Because up until this year, people weren't talking about it, at least in the general community. Maybe in the enforcement community it was more well known.
Well, I think it's certainly getting more public attention, more media attention. Two reasons. First off, years ago, within the last 10 years, law enforcement has faced the challenge of dealing with the prescription drugs. An unintended consequence in going after the false prescriptions, the overprescribing, the oxycodone type drugs. We've made that very difficult. We've increased the charges on that. We've made it difficult to purchase it. We've made it difficult to get the fake scripts. Unfortunately, the unintended consequence is heroin's still there. So when you have people addicted to some of these prescription type drugs that have heroin-like effects, when you take that away, what are they going to go to? They're going to go back to heroin. In Fairfax, geographically, we're very close to several source cities. Our residents can easily go to any of these cities, and the proximity is easy, the availability is easy. It's a very easy drug to get on the street, and it's cheap. $20 bag.
Well, what does a $20 bag mean? Because I think of marijuana where you have to get a little baggie, and that's what you mean by a a bag. Is that the same thing? Same
thing. Most of your addicts will go get a $20 bag, or continue to purchase $20 bags at a time, or they might purchase larger quantities. They may purchase several grams of heroin, whatever it takes to get their body to what they need. And those addictions, that can vary per the person. Most people will go and get the $20 bag, and it will last them for as long as they need. And then when they need to get that fix again, they'll go and get it again.
So how much, I read some news report that said 1.9 pounds of heroin was seized in Fairfax County last year.
That's correct.
Is that a lot of heroin?
Yes, that's a substantial amount, absolutely.
So is there a usual, is it like a gram is what people usually take? Is that considered like one shot, hit, whatever?
Most of your addicts are lesser amounts. You will see a gram is not uncommon. It's fairly a common amount, a couple grams of heroin here and there. As they get more and more within the throes of addiction, it's going to take more and more to get that same high. So the amounts are going to take more to get that high. So 1 gram will go to 5 grams, to go to 10 grams. So it's going to continue to progress.
Well, is there a profile of the typical users? Are these young kids? Are these older folks? Who gets in? I mean, if you're starting off with prescription drugs, is there
It's a good question.
An age that's typical? Or?
When I started in law enforcement, it used to be what was known as what we would term the back alley drug. Your typical heroin abuser was a prostitute, a hardcore drug user. Now that's changed dramatically. Now it can be anyone. You'll see a lot of stories your young adults now are abusing because they've started out dealing with some sort of illness or some sort of pain, some sort of injury where, they hurt their knee, they were prescribed oxycodone or Percocet or what have you, and they became addicted. And then they progressed. Once the doctor stopped prescribing that oxycodone for that particular pain, their body still needed that. So they've turned to heroin. And that's what we're seeing more and more of. You're hearing a lot more and more of those stories. So to say that there is an actual profile of a typical user, not anymore. It used to be heroin, people would frown upon injecting themselves with anything. That stigma is gone.
Now, is that the only way people do heroin? There's other ways of doing it. You don't have to inject, right?
Absolutely. You can inject, you can snort, you can smoke. So there's a number of different ways. And we've seen it all. We've seen it all.
But the injecting is where you get the immediate rush, the
Correct.
immediate high. So
Absolutely.
That's sort of the preferred if you can
it goes right into the
manage to
bloodstream.
do that.
Right.
Now, do we have a lot of overdoses? I know I read about an overdose. I think it was a McLean High School student, maybe earlier in the year. Mm-hmm. Is that a problem in the county?
Last year we had, I believe it was a total of 54 overdoses in the county and 9 overdose-related deaths. This year we're seeing, to this point, we're just under 60 and we're at 15 overdose deaths.
Wow.
So the numbers have increased. It's definitely something that obviously has our attention. It's gone up, something that we're concerned about.
So why have the deaths actually gone up so much?
I think it's a combination of, you're seeing, what we're seeing on the street is the purity of heroin has gone up dramatically. Mm-hmm. Years ago, heroin used to be at a 5 to 10% purity. Mm-hmm. So people were more able to handle it. And now what we're seeing is you're at a 30 to 50% purity. So that immediately impacts the body. Also, your dealers, when they're selling this, they're going to step on this with a number of different things. So they're going to mix it with, as you've heard, the fentanyl cases have gotten a lot of attention. So the dealers will they'll mix it with just about anything. And, that can cause overdoses as well.
Now, is fentanyl, because I had read someplace that was like 100 times more potent than heroin. Is that just a chemical substance that
Correct.
Anybody can make? You don't have to grow that anymore.
No, you can make it.
You can make it.
And it's 0.25 milligrams, I believe, that can be a fatal.
Wow.
Correct.
Okay, so that's really devastating. Now, I had read that there was some drug that is like an antidote, that if somebody is overdosing on heroin, does that work? Do the police carry it? How does that
We don't carry it. We're very lucky here in Fairfax. We have a very professional firefighting service, so they'll deal with the overdose part of it. When we have an overdose situation, we'll immediately call rescue. They come in and they handle the medical piece of it. Okay. And typically, when we're dispatched to an event like that, we're simultaneously dispatched. So police don't carry that. Okay. Our fire and rescue EMS, they do that. So, and we're usually arriving about the same time.
Okay, now you're the commander of the Organized Crime and Narcotics Division. So
Yes,
is there anything that the Fairfax County Police Department are specifically doing to address this issue? Are there big task forces or?
There's a number of things that we're trying. We are certainly part of the statewide effort. I attended the October 2nd summit in Charlottesville. Mm-hmm. We have our own. I have 2 detectives assigned to dealing with heroin cases specifically. They respond to any overdose situation. They're in constant consultation with our major crimes. If it is an overdose death situation, we'll work it as a simultaneous type investigation. We have partnered not only with our own Commonwealth's Attorney's Office, we've partnered with the state's Attorney General's Office, our federal partners, FBI, DEA, our regional partners, sheriff, several of our surrounding jurisdictions. What we're doing right now is we're identifying targets, for lack of a better term, that are distributing the heroin and going after them in a regional type grand jury situation. So that's what we're doing right now. We're gathering that information to further our investigations. We're trying to avoid, targeting our addict or abuser. Mm-hmm. What we're trying to do is change that up front and get those people help. We're trying to get the addict help. That's what we want to do. So we've partnered with our UPC, we're partnering with our medical community, and we're trying to offer services up front in hopes that we get information about the dealers and we're able to focus our efforts and direct our attention towards going after our dealers. And when we do get them, we're trying to enhance penalties at the end. We're trying to enhance the distribution where we're getting after them. So those are the efforts that we have underway now.
Okay. Well, I appreciate you explaining all of this to us and setting the stage. And I want to thank you for coming, and we'll bring you back again for some progress reports.
Great. Thank you.
One day these rats were playing in the woods. Well, it's some matches and that's no good. Listen to smoke before you give it a try.
Only you.
Don't play with matches. Don't play with fire. Cause there's nothing very funny about rigged out life. Nothing very nice on a homeless mind. So if a gorgeous force is what you desire, don't play with matches. Don't play with fire.
Only you can prevent wildfires.
Fire.
Why don't you just wash your car at home?
When I wash my car, everything runs down the street and down into the storm drains. With all the chemicals in the soaps and waxes, the last thing I want to do is poison my own drinking water. At least here, it's all contained and recycled on site. That's why I also take my car in for oil changes instead of doing it myself. I might take a chance on spilling stuff. You know what the best part is?
What?
More time to kick back and watch the game.
How far would you go to protect the planet?
I want you to build an ark.
Here we go. Okay, that's good. Oh, okay. Ow!
Maybe there's another way.
People, the flood is imminent!
Is it too much to ask for a little precipitation?
Go to fightglobalwarming.com to find out what you and your community can do to reduce global warming pollution.
Somewhere around the world, there are men and women of the armed forces risking their lives, helping rebuild communities after natural disasters, collecting toys for needy children, tutoring kids in school. These are your sons and daughters who work to keep us safe, secure, and free. Dedicated men and women who put their country first.
to the Inside Scoop. Here again, your host.
Saving.
Welcome back to Inside Scoop Virginia. I'm Bettina Lawton, and I'm your host, and we are talking about heroin. And now we're going to talk to three folks who are involved in this in sort of an education preventative way. Immediately next to me is Kathy Briggs. She has her master's in social work, and she is a social worker in Northern Virginia, and she is the mother of a child who died from heroin, and we're going to talk a little bit about that. Jennifer Lewis Cooper is the Protect Coordinator for the Unified Prevention Coalition. Jennifer's been involved in the prevention field for more than a decade. She's one of the founders of the coalition and is currently its finance director. She is also the volunteer coordinator for the Protect work group, and she's going to tell us what that is. And then we are also joined by George Young. He is the vice president of the coalition, and he is also a senior clinician for the National Counseling Group and state director for the outpatient services. He is a licensed clinical social worker and a trained juvenile forensic evaluator. He received his bachelor's of social work degree from James Madison University in 1978 and his master's of social work from VCU in 1989. So let's start off with the broadest question, which is, what is the coalition?
Well, the Unified Prevention Coalition of Fairfax County is a nonprofit that got organized as a result of the school system, which used to have coalitions in all the major high schools in the county. The funding went away, so about 5 of us joined forces and became the Unified Prevention Coalition. We organized ourselves as a nonprofit, and our main goal is to keep our youth and young adults in our county safe and drug-free.
Okay, and so how long has heroin been a part of that? I mean, we just talked with Captain Cleveland, who said it didn't used to be as big as it is now. Have you been focused on heroin for a while?
Yes, for about the last 5 to 6 years. It has been in our focus quite a bit. We got really involved after the heroin ring. The sting came down in 2008. We lost a young adult in our community. The Lannis family lost their daughter. And that next year, the community and the people out in the western part of the county really wanted to rally and do something to bring awareness to this problem. They were normal families, normal moms and dads, normal children that got involved in this terrible ring. So we kind of band together as a grassroots organization, kind of just, we formed ourselves as Protect, and it stands for Parents Reaching Out to Educate Communities Together. And that's what we did. We went to the major high schools, we put a panel together, we talked with the young adult that was the addict in recovery, the families of young adults or children in recovery, and those families that had lost a child. We had law enforcement on the panel, we had treatment prevention coordinators on the panel, and we brought our forum to many of the communities. I've calculated we've done about 25 programs over the past 5 years, and we're continuing this year. We have 2 programs scheduled so far before the end of the year. One's on November 10th at South County High School at 7 p.m., and the second one is November 18th at Fairfax High School. And the panel consists of a young adult in recovery, a parent or a family member that was in their child or their sibling was involved in addiction to heroin or another drug, law enforcement, the judicial system, as well as the treatment aspect of it.
Well, how do kids in high school or younger kids get heroin? It just strikes me as such a big drug. It's not like marijuana, which of course I'm dating myself when I say that, but it's not like marijuana where you could grow it in your garage or something. I mean, how are the kids getting it? Are they getting it, these dealers going to the schools? Where are they getting it from?
I don't know what you can add.
Cell phones, just this use of cell phones by texting, by phoning each other. They're constantly making connections. They do it in parking lots, at grocery stores, and shopping centers. They do it in parks. wherever, but word gets out there with the cell phone. We just don't have a lot of control over the use of the cell phone, and there's a lot of communication that goes on.
It's just much more accessible, and as what Captain Cleveland was talking about earlier, in terms of the increase on the streets, and that trickles down certainly to the youth, and it's talked about. It's much more just media hyped, and so everything is sensationalized right now, and so I think the students certainly pay attention to that, and it is available, and it doesn't take much to figure out where to get it.
Well, it's this now. Captain Cleveland talked about sort of this progression from the prescription painkillers and moving in from heroin to heroin from that basis. Is that what kids are doing? Or are they taking a different route altogether? Is this just sort of the exciting big rush? Try it, or are they starting with the prescription painkillers?
Students are definitely using the prescription painkillers. There's been a huge increase in the last several years of increased availability of the medications, and then them using them to get high. And that certainly has been a component of the increase with the heroin, because as any of those students get into a strong pill opiate effect, then there's a very natural bridge to then move over to heroin, or if they become chemically dependent, then they're going to move into seeking it on a more easier level basis, which is on the street.
Okay.
Kelly, did you find any personal experience?
Well, I was going to say my son started out with marijuana, and I'm hearing from one of the detectives that they're now going from marijuana right into heroin because the opiates aren't so easy to get. But my son was involved with opiates, and then he was on to Suboxone to try to deal with that, going through the withdrawal period and maintaining, it's like a methadone. But he was also, must have been accessing heroin, little did we know. But they're also using Xanax a lot out there. Yeah.
Xanax?
Yeah, Xanax. His roommate had an overdose of Xanax and had seizures.
Oh my heavens, I didn't know they were abusing that.
Yeah.
What we're finding too with through the Unified Prevention Coalition's efforts is underage drinking. It kind of starts there. The inhibitions get let down. Kids feel more at ease to experiment. The few young adults we've had on our panels started there as young teens, and it graduated into the easy accessibility of marijuana. And then through friends, older friends and groups, it just progresses. So it doesn't necessarily, right.
Yeah, medicine cabinets, yeah.
Now, how do you know? I mean, how did you become aware that your son was using heroin? Are there symptoms? I mean, what should parents be looking for?
Actually, we did not know that my son was using heroin, and we're still waiting for the final medical examiner's report, but we have a strong suspicion that he was, and that's how he did die. But after he did die, I heard from a friend of mine whose son was using heroin, who said, gosh, Mom, when you described him falling asleep at the dinner table, his eyes closing, he'd be having a fork coming up to his mouth and he'd be falling asleep, and I'm petrified of him driving. When they're in bed in the morning and they won't get up, as the detective said, when they're nodding off at a party, falling asleep, they start to snore. Their respiratory system is shutting down, and that's when you've got to get Narcan on board, get them help. But unfortunately, these kids don't know the signs, and it's this code of silence. They have to be quiet. They can't tell anybody about it because they'll get into trouble themselves.
The other, a couple of other early symptoms or indicators that family members see are constipation, GI issues, cramping, a lot of stomach problems, complaints of pain. So those are very typical and go very much along with opiates and heroin use, because those are some of the withdrawal effects that then, as the addict becomes chemically dependent, they are really working to avoid. But we see that it's subtle, and there's just general increase in those complaints. That would be an indication that something's not right, and maybe connecting it with other visible details, such as pieces of balloon or baggies or aluminum foil or lighters or candles, things, maybe even some powder substance on a counter that's not normally there that you wouldn't see. Why would that be on the bathroom counter or the kitchen counter even, or the table? It's like, well, this shouldn't be here. And beginning to put some of those things together, because by themselves it's not anything, but together it becomes a huge problem.
Right. Well, when you were saying about them being tired and falling asleep, I was like, well, that's the whole thing you hear about. Oh, we need to change school start times.
Right.
And aren't they all that way? And aren't they all withdrawn? And it's really tough. Can anybody get a presentation? You've mentioned 2 school presentations coming up.
Yes, we have talked at many of the major high schools over the course of the past 5 years. We've talked at one of the private schools in town. We've talked to all the police community groups at all the police stations. Anyone can go to our website and contact us, unifiedpreventioncoalition.org, and put on a presentation. We're happy to go and get the word out, educate, and make people aware that this just isn't, like the captain said, the people you think of like drug addicts and others like that. This is real people, the Briggs family, the Lannis family. These are real people like you and me that you would never suspect something like this to happen to.
So if somebody, for example, when you say you go to schools, though, but you go beyond that in terms of like churches could get you and other folks can get you as well?
Yes, ma'am.
Okay, so you have to go to the website for that. And you've got the presentation that you do. Are there individual things? Can you refer people to help, or do you just do the presentations?
Well, we do have a number of parents associated with our Protect group that have been down that road with their child, and they're more than happy to be advocates and help other families, someone to talk to. As part of our panel, we do have the treatment aspect of it, and we work through the CSB here in Fairfax County. So there's a resource there for parents to learn about and a place to call to get more information. We can provide some information. We're not counselors. We're hardworking grassroots prevention folks that really want to help communities and our families in those communities. It's very important to us to not let this happen to other wonderful children, good kids that have a great future ahead of them.
And part of it for us is really to make sure that we're raising the awareness, right? Putting it on the surface for people to understand that that this really is happening, and that it can happen to any one of us, and not to mention any one of our children.
Right.
So that's the really important piece.
Well, and I think that's really the new piece for a lot of people, because they did think, as Captain Cleveland said, that these were hardcore, live on the street people.
My neighbors and friends were shocked. They were shocked.
Well, and hopefully we can do something to avoid that. I want to thank you all for coming and being on the show. We'll be back.
Saving for retirement might be easy for some folk, but for others, it might take a little more work. And for those who haven't started, there are still things you can do to catch up.
Oh, that is good news.
Like getting out from underneath past debt. And don't get wrapped up with high-interest credit cards.
Get you some eyes.
Be diversified with your investments. Don't put all your eggs in one basket. Your financial goals are not out of reach. The choice is clear. For a happy ending, choose to save.
Everyone with alcohol and drug addiction is in the same boat. With treatment, you can find solid ground. For drug and alcohol information and treatment referral for you or someone you know, call 1-800-662-HELP.
Dude, are you sure you want this tattoo? Because just do it.
Some mistakes in life are permanent. Like hearing loss. To learn how to protect your hearing, visit asha.org.
You've probably heard about heart disease, but did you know that it's the #1 killer of women nationwide? Heart disease claims more lives each year than breast cancer, lung cancer, or strokes combined. But there are steps you can take to protect yourself against it. For more information on how you can prevent heart disease, contact your local American Heart Association or visit their website at www.americanheart.org.
We're back to the Inside Scoop. Here again, your host.
Welcome back to Inside Scoop Virginia. I'm Bettina Lawton and I'm your host. And tonight we're talking about heroin. And so we are going to move into talking about treatment options and what's available and what works and where do you go and what do you do? Because clearly what we've learned so far is that a lot of people are affected by it. A lot of people who had no clue that this was happening to their children. So we're going to try and get some clarity on what's out there. And we are continued to be joined with George Young. He is the Vice President of the Unified Prevention Coalition of Fairfax County and is also, as I said earlier, with the National Treatment Group.
National Counseling Group.
Counseling Group. We also have immediately to my left Peggy Cook, who is the Director of Residential Treatment Services for the Fairfax Falls Church Community Services Board. She is a licensed professional counselor and a licensed substance abuse treatment practitioner. She has over 25 years in the field of addiction and mental health. And to her left is Betty Petersilia. She is a licensed clinical social worker and the manager of the Youth and Family Services at the CSB Woodburn Center, which is in Annandale. She has worked at multiple youth treatment sites within the CSB for over 35 years. So welcome. I'm glad that you were able to join us tonight. So let's talk big picture first. If you think that your child is using heroin, so you've seen some of the symptoms that we talked about in the prior segment, and you think it might be heroin, what's the next step? What do you do?
Make a call.
Okay.
Make a call to the Community Services Board. That's one option. We have a 24-hour emergency service that's available 7 days a week, 24 hours a day. We also have our entry office, which is open during normal business office hours, where someone can call at 703-383-8500. If you're not comfortable talking to a professional right away, if there's a school counselor, if there's a teacher, if there's a pediatrician who you're used to talking with and sharing your concerns with, any of those folks in your immediate community could also be someone to contact.
Let me ask you about your emergency number. If I think that one of my children is using heroin, unless they're like actively ODing in front of me, would your emergency services actually respond to a, hey, I think my kid is using heroin? How much of an emergency do you need for that number?
Well, obviously, if it's an in the moment and you're serious concerned about your child's health, you're going to be calling 911.
Okay.
So when you call our emergency service, you're sort of in a stage of exploration, I guess, about asking how much of a problem might we have. Mm-hmm. You know, what are you seeing? What have you observed in your child? What have you noticed? Physical symptoms. Are they spending time with a different kind of crowd? Are they going places you don't know about? And so you'd have an opportunity to talk to a trained therapist or an MD, depending on the time that you called, mm-hmm. and getting some information and some direction on what might be the next step to take to get help.
Well, now let me ask you this, and George, I sort of look at people who are not government affiliated. One of my concerns would be if I were to call the CSB, for example, or if I were to talk to a school counselor, I mean, there's going to be a record. And do people call organizations like yours, George, because of that concern?
There certainly is that fear. There is that fear. It's not always founded. And I think the biggest point is to make the call, mm-hmm. talk with somebody that you have a concern. And of course, it may not be about a student. It could be about your husband. It could be about your girlfriend. You know, so it really could be, we're seeing it at all levels at this point in time. But the private sector can be a little bit more discreet at times. But the main issue is getting help right then and getting assistance as where to go, which is what the CSB will do. They'll certainly help direct the individual who's on the other end of that phone call to say, here's some options. If it's not an emergency, here's some treatment, or let's get them in for an evaluation. Here's options to do that, whether it's private or public. And so we work pretty well together in Fairfax County to really try and cover all the bases between the private and the public sector.
So I guess part of the message that has to go out to people is, particularly given what Captain Cleveland said about how addictive heroin is this is not something you sort of putz around with and say, oh, it's not going to be too bad, I'm not going to make that call, because you could end up not taking action in sufficient time, and your child or your loved one ends up being one of the ones who actually ODs or gets really deep into the addiction.
And when you're talking about adolescents in particular, and then the fact that they're still developing, they can move from an experimental use into an addictive process pretty quickly because of how heroin enters the brain and how fast the addictive process can work.
So what does it do to the brain? Are they irreversible?
It rewires it.
Really?
Absolutely. And as Betty's talking about that adolescent stage of development where the brain is still very much in a growth phase, right? It's developing and it's not done yet. And then they're adding the chemicals, and particularly any of the chemicals, but something as significant as an opiate and a heroin is really laying down massive new tracks that are going to be very difficult and are going to be life impacting.
Okay. In Fairfax, we've got folks, as we always say, sort of the Route 1 corridor, and then you've got the people up in Great Falls. There's this huge economic divide. Does that really dictate where the treatment can happen? I don't know I don't know if insurance covers this type of treatment, if Medicaid covers it. I mean, how do people who are merely hanging on, for example, handle this? What do they do?
Well, insurance typically will cover some treatment, so that's the good news. And also, the federal government has a great website that will give access to a treatment locator, and that's in fact the name of the website. It's treatment locator, or locate treatment at SAMHSA, which is samhsa.gov. And that you can put in your zip code, and it will give you private and public options for what treatments are available, and then you can get more information. So that's a great opportunity.
Okay, excellent. I didn't know about that.
There's never enough treatment, though, and there's never enough funding for the treatment.
Right.
Okay. Fairfax, I think here in our community, we've got incredible resources compared to, I think, a lot of the rest of the country. Fairfax County puts a lot of funding into the Community Services Board. There's some residential programs, there's a detox program, and then the private sector tries to backfill. But again, it's not enough, and it is incredibly costly, and insurances don't cover enough either. And so there's always struggles for everybody, for no matter what part of the country we're in. And so we're part of our work is with the Unified Prevention Coalition is to continually advocate, and the CSBs do that with the state level, advocate for more resources to try and disrupt and decrease some of the increases in chaos that the substance use is causing.
Now, are there specific locations in Fairfax County that deal with heroin? Is it done in conjunction with other addictive behaviors, or are they separated out, or how does that kind of thing work?
We don't typically separate out programs for one drug versus another, but heroin is a very potent drug, so it's often true that the folks that are on heroin end up needing a more intensive service than someone who may be involved with some other drugs. So we do have outpatient sites that are located in the Annandale area. We also have the Route 1 Mount Vernon area. We have a detox center in Chantilly. We have several residential programs that are located throughout the county. Those don't serve people just in that jurisdiction. They would serve people throughout Fairfax County.
Okay, so it's not, if you've got the location is in your area, the county, that doesn't mean somebody else can't come in and access that service.
Right, and we really try to make it accessible to people. So it's somewhat up to what the individual's choice is. Sometimes they are still having a job and they may want to go to a site that's closer to their work versus closer to their home.
And is there, you said you have a detox facility, is there a standard time frame that it takes for someone to, I don't know if getting free of heroin is the way to put it, but how long does it take to work through all of those withdrawal symptoms and things like that?
Folks are typically at our detox program for 7 to 10 days if they're involved with heroin. But the issue is that you're going to be having some post-acute withdrawal symptoms for a long time after you leave. So while that's getting you over the initial stages, there's going to be ongoing physiological effects for quite a long time after that. People tend to continue to have cravings and desire the drug and even have physiological symptoms going into weeks and months afterwards.
Oh, wow.
The detox is only just the very beginning. Really, that's just the stage of trying to allow the individual to get stable and allow the immediate effects of the drugs to be removed. Then the treatment begins. It's very difficult to start treatment while somebody's still under the influence.
Right.
So that detox is just the very, very beginning of the phase.
Now, are there drugs, when you say the treatment, is once you get past the detox phase, is the treatment sort of the talking to a therapist? Are there other drugs that you use as trying to sort of wean them off? How does that all work?
The newest drug that we have been using is called Suboxone. It does help people get through the cravings and the physiological effects of the medication or of the heroin by substituting with medication. The medication is designed so that it's harder to abuse, and that is helpful for some folks, but you do need to combine that with cognitive behavioral talk therapy to really learn some new coping skills, learn some new ways of managing your life without using drugs.
Wow.
And I want to add, Bettina, on the adolescent side of the house, we still really see the prominent drug use being marijuana and alcohol, and an increase in the use of prescription medications, which was mentioned earlier in your program, how that can lead to the heroin use. So we're seeing the heroin use possibly beginning in late adolescence and popping up on the adult side.
Okay.
And so in our treatment experience, we're seeing kids primarily with the alcohol and marijuana. They can access 4 outpatient sites throughout Fairfax County, and we also have a residential treatment center for adolescent boys. And if it involves a young woman, we'd be looking at other resources immediately outside our community and trying to connect them if they need a residential service.
Okay. What's the expectation of relapses? Is there a recovery that says somebody who goes through it the first time is going to, has a 50% chance of not relapsing or 80 or?
It is a part of the recovery process. There's going to be some relapsing, and with the opiate, it's got to be very seriously taken because of the chance for overdose.
Right. Well, I want to thank you all for coming and talking about what's available for treatment in Fairfax.
Thank you.
Thank you so much. Stay with us. We'll be back.
I need a job.
Necesito trabajo.
I would like to speak English better.
Me gustaría hablar inglés mejor.
I want to be a U.S. citizen.
Quisiera ser ciudadano de los Estados Unidos.
For over 35 years,
Por más de 35 años,
the Hispanic Committee of Virginia has been serving our community.
el Comité Hispano de Virginia ha estado sirviendo a nuestra comunidad.
Job training and placement,
Capacitación, ayuda para conseguir trabajo,
education for children and adults,
educación para niños y adultos,
immigration, naturalization, and medical referrals.
ayuda para los procesos de inmigración y naturalización y orientación sobre médicos
Are a small part of what we do.
son solo una pequeña parte de lo que hacemos.
For help, information, or to volunteer,
Para ayuda, información o para ofrecerse como voluntario,
contact the Hispanic Committee of Virginia,
comuníquese con el Comité Hispano de Virginia,
helping everyone participate more fully in American society.
ayudando a todos a participar plenamente en la sociedad norteamericana.
Hey, Lena, where's yours?
Would you notice if you were missing half your kidney function? According to the National Kidney Foundation, 20 million people have chronic kidney disease, and 20 million more may be at risk and not even know it. Anyone with high blood pressure, diabetes, or family history of chronic kidney disease is at risk. Early diagnosis is vitally important. To get the whole story, talk to your doctor and visit the National Kidney Foundation at kidney.org or call for a free brochure. Because when it comes to chronic kidney disease, you might not know the half.
We're back to the Inside Scoop. Here again, your host.
Welcome back to Inside Scoop Virginia. I'm Bettina Lawton and I'm your host. And we are back to the law enforcement perspective. We have with us Sheriff Stacey Kincaid. She is the Sheriff of Fairfax County and Fairfax City. And we have with us Vera Giles. She is the Health Services Administrator at the Fairfax Adult Detention Center, more commonly known as the jail. And we're going to talk tonight about what happens. You've done whatever it is, and somehow you didn't recover, and the police have honed in on you, and now you are ending up in the jail. And that's how we're going to end this segment. And hopefully you should take a tour of the jail sometime. I took a tour of the jail, and while I'm pretty law-abiding, it really scared me straight. So we're going to talk about it tonight. So welcome. It's good to see you again, Sheriff.
Nice to see you, Bettina.
It's good to meet you, Vera.
Thank you.
Let's talk about sort of generally, Vera, how extensive is the health care provided at the jail?
We have a comprehensive medical team. We have a medical director, Dr. Costa, who leads our team. We have 2 nurse practitioners. We have a director of nursing who supervises 30 nurses, as well as correctional staff and public health technicians on our team. And they provide services throughout the facility, throughout the jail, 24/7. So very comprehensive, extensive medical care. And we also have a dentist as well.
Oh, good heavens. I don't want people thinking, gee, I need to go get my health care at the jail, including my teeth. Now, Sheriff, let me ask you, will people, if someone gets arrested on the street using heroin, so they're totally high, are they brought right to the jail, or is there do they take them someplace else for them to detox, or what? They just come straight in?
They come straight into the jail, and again, an assessment is made once the officer brings in the prisoner. An assessment's made by a nurse from our medical staff. And certainly if the officer had experienced on the street with this person any kind of possible problems with maybe an overdose, then that individual will be taken to Fairfax Hospital or to one of the hospitals. So they'll come straight to us and we'll do an assessment, and then it's our responsibility to, the medical section's responsibility to get them stabilized and keep them safe.
Well, how do you know, and this is no doubt showing my ignorance of drug users, how do you know if someone comes in and they're acting crazy, whether it's alcohol or it's heroin or it's marijuana or cocaine or any of the others? How do you determine that?
Many times there's not a cut and dry way to really determine that. You have to monitor very closely every 15 to 30 minutes, and just to watch for different signs and symptoms of different drugs, especially with the withdrawal process. You have to manage that. Many times for our substance abusers, they're actually arrested because of possession. So because of the possession or the intent to distribute, so we might have a clue what the drug or the substance of choice. But that's not necessarily true. Just because you distribute doesn't mean that you're going to use. So we have to become medical detectives, so to speak. And we have different protocols based on the drug that we think, based on symptomology, whether it's opiate, heroin, or alcohol. So we actually have protocols that we have to follow and to manage and to stabilize the clients. And I tell you, it's a challenge for our medical team, because they're not only stabilizing from a medical perspective, but they're also looking at it from a behavioral perspective, because this is at the most vulnerable state and cooperation is not high on the list, you know? So they're dealing with both. They're dealing with the behavioral issues, the combativeness when you're first brought into a jail, as well as potentially withdrawal.
So are they put into sort of segregated single person cells? How do they, when they are coming in and they're high, are they separated from everyone else, or
when they're coming in and they're again assessed by not only our medical section but also our mental health, our forensic section, which are members from the Community Services Board, and the determination is made based on if they are withdrawing from, some type of drug, narcotic, alcohol, and if that is the case, then they are monitored, as Vera said, every 15 minutes, but they are put in a housing location which is conducive to our ability to provide high observation.
So how many heroin substance abusers are in the jail? Do you track it by drug, or is it just?
It would be somewhat difficult to track by drug, and when you combine also the other challenge, which is the mental health piece of it, because our numbers are quite high, and as you well know, we are the largest mental health provider in the warehouse.
Right.
And it is estimated that 70% of our inmate population uses or has used some type of illegal substance.
So do you find a lot of them then, like you must, if it's 70%, you've got a lot of having to deal with both sides of that at the same time?
We do.
Wow, that's pretty bad. Now, what about, do you see a difference in the gender of who comes in with the substance abuse, or the heroin in particular? Are there more men showing up, more women? Are there different issues between the men and the women who are coming in?
I just want to, Captain Cleveland mentioned when he was on the show, and we were talking out in the lobby about when we started many years ago, and how it was basically one particular age group that you would see more often than not, and now it's anybody. I mean, it can be somebody that is in their 20s, in their 30s, in their 50s, in their 60s. Wow. And I'll let Vera speak, because we're having concerns with females that come in that are pregnant and they're on heroin.
Oh,
and
wow.
Of course, the babies, the unborn babies.
Well, what do you do with that?
Well, we have to assess and stabilize from a medical perspective, because most inmates that arrive in the ADC, in the jail, they've used 2 to 3 hours prior to arrival. So probably within 2 to 3 hours after they arrive, the withdrawal symptoms will start to show. For a woman that is pregnant and also addictive and actively using, they have to be sent to the hospital to stabilize them initially, because you cannot withdraw from an opiate while you're pregnant because of the potential risk for the unborn fetus.
Really?
Mm-hmm.
Wow.
So we will stabilize through a local hospital that we have a partnership with, and that's how we partner back and forth, and once they're stabilized, they come back to our facility and we manage them through their prenatal and until their release, and sometimes, after the birth.
Oh my
as
heavens.
well.
People have babies while they're in the jail?
They have babies while they are locked up, but again, they go to the hospital. Hopefully, unless, of course, we end up having to have the child delivered in the adult detention center.
And we try to avoid that.
Which we try to avoid, but it's happened.
It has happened. Oh, my.
It has happened.
In
the courthouse, so, yeah.
Oh,
we have a very dynamic medical team that they are like first responders, and they have to be prepared for anything.
For anything.
Absolutely.
So when the people from the CSB were on, they said in their detox program, you can be there for like 7 days. I mean, is that what happens when you send them to the hospital, or do they get shipped back to you faster than that?
It's much faster than that. We usually, stabilization is usually with the hospital within 3 days. And then when they're with us in our medical infirmary, when we have our heroin abusers in the medical infirmary, and when they're withdrawing, it's generally between 3 to 6 days. For heroin, it's like a very, very bad flu. So we're managing the symptoms when they're withdrawing, and we keep them in our medical infirmary so we can keep a close watch on them.
Oh, okay. So they're not put into a special general population kind of thing?
Not
in the medical
when you
section?
have severe withdrawal.
Right.
We have a scale that we use, mild and moderate, they can go to general population as far as their symptoms, the withdrawal symptoms. When it's severe, they come to the medical infirmary and we manage and closely monitor.
Okay. Now, if somebody comes in, I mean, you've got 70% of your population having been substance abusers at some point in time in their lives. Are there special programs within the jail that you use? I know you're big on trying to rehabilitate people and try and decrease the amount of recidivism when people leave the facility. Are there special programs that you all run in the jail?
In the jail, we're fortunate again because we have a group of folks from Alcohol Drug Services through the Community Services Board that provide programs to our inmates. We have every class from AA to NA, not only in English but in Spanish, as well as other intensive addiction programs, and again focused on our inmate population in hopes that once they go back into the community, they're going to continue to get the help that they need. And again, once they go back out, if they go back to the same the same area and hang out with the same folks, then of course that becomes the vicious cycle because there's only so much we can do once they get out of jail.
Right, that is true. And is there anything to help them? I mean, not through you all. Once they're out of the jail, you're no longer responsible for them. Is there some program that, you hand them their bag full of clothes or whatever it is you do when people get out of the jail and say, and go to this program or go see the CSB? What happens then?
Because the CSB is within the jail and they work so closely with us, they're already in the system. So the CSB, they have all of the information. They're in the credible system, and there are residential treatment programs, and that transition for the reentry is a great path to try to minimize the risk of return.
Okay, well, let me ask you, Captain Cleveland mentioned that he attended the summit, the Heroin Summit that the Attorney General put on. Is the Fairfax Sheriff's Office involved in that?
We are involved from a local standpoint in that we did not attend the summit, but Captain Cleveland came back and was charged with establishing and putting together different subgroups that they were able to reach out to because, again, Fairfax County can't lead the charge on trying to combat this heroin problem by virtue of the resources that we would need. But we do have people that are participating with the Fugitive Task Force.
Okay. Well, I appreciate you coming tonight and talking with us about how it's handled at the end of the trail, or at least at a way station on the trail when they come to the Adult Detention Center. So thank you very much for coming, and that's it for us tonight. We'll see you next week.